Hi, Miss Carly. I'm Molly. I'm going to be your nurse today. I'm just going to do some hand hygiene before I come in. Can you go ahead and give me your full name and your date of birth for me, please? I'm just going to match your wristband to the chart. So, Brenda Connolly. What's your date of birth for me? 7/4 of 1948. Good. And then your medical record number, we're just gonna match it. So 1-000-1000-1609 1609 4343. Wonderful. And do you have any allergies that I should be aware of today, Miss Connolly? Sulfa drugs? Okay. Well, we won't be giving you any medications right at this moment, but I'll be sure to keep that in mind. As I said, I'm Molly. I do have an order from your provider today to do a central line dressing change. It's in here for every 7 days or PRN as needed, and today is that day. So I'm just going to explain to you the procedure very quickly. So all I'm going to do is remove the old dressing that is on there currently. I'm going to clean it with a chlorhexidine scrub and then apply a new sterile dressing to your central line. Do you have any questions for me before I begin? No? Wonderful. Okay, so the first thing I'm going to do is some hand hygiene again. And I'm going to don clean gloves. And Miss Connolly, I'm going to have you look away from your dressing, so towards the wall that way. And I'm also going to give you a mask that you can wear during the procedure, just so that everything is nice and clean. First thing I'm going to do is I'm going to open my central line kit and grab the mask for myself and don it like so. I would also be sure to raise the bed up to my waist, my working height, as well as my table that I'll be working on, as well as when I'm setting up my sterile field to make sure that I never have my back turned to it. So it'd be in my peripheral vision the whole time. So now I'm going to go ahead and remove the current bandage, making sure to hold the catheter in place, like so. I'm just going to lift the dressing upwards, like so. And with that, I'm also going to assess and use the garbage spot on the floor. Normally I would have a garbage can, but for this purpose, that will do. I will assess the site for any redness, any drainage, any skin breakdown, everything like that, which it does not appear to have any. So I'm just going to remove my clean gloves and hand hygiene again. Continuing on with my sterile technique, I am going to open up my sterile gloves. You can see them. I'm right hand dominant, so I'm going to pinch with the left. And apply my glove, and scooping the second. Definitely put these in backwards, keeping them over my sterile field. Again, I'll be above waist height now that my gloves are on. I'm going to grab my chlorhexidine scrub, crack it like normal. I'm going to assign my left hand to be dirty, and so this one will be holding the catheter in place. I'd also stabilize the catheter if need be. So I'm just going to stabilize the catheter, and then using my chlorhexidine scrub back and forth motions all the way around my catheter for about 30 seconds. So having an eye on my sterile field the whole time. And then I'm going to let that completely dry. Again, this would stay at waist high, and I would drop it into the garbage. Now that I've let the chlorhexidine dry, I'm going to grab my bandage. This is the Band-Aid that I have. Again, my left hand is dirty, so I'm just going to make sure to grab the tab of it to maintain sterility, and then apply. Sorry, I'm using my iPad as don't have access to a printer, so that's the best I can do for the chest. And discard the wrapper. I'm then going to discard my materials, so my gloves into the garbage, as well as my mask. I'm going to time, date, and initial the dressing, and I would apply this sticker, but I'm just going to write it on the dressing like normal. I'm going to hand hygiene. I'm going to lower the bed back all the way down, make sure the side rails are up and locked, having the call light within reach. I would also put my table back down to its normal height as well. Discard all of my materials into the garbage per normal. I would document everything in Miss Connolly's chart, including saying that there was a dressing change on her left subclavian central line. I would thank my patient. Thank you so much for letting me do your central line dressing change. I would then hand hygiene, and I would leave the room. Thank you.